So it's another Monday evening at the Health Campus, and I want to thank you all for joining us this evening. My name's Larry Meredith, and I'll be one of your co-hosts along with Supervisor Adams. And the reason for tonight's presentation by one of our more distinguished presenters is that health equity is something that we all from time to time talk about, or at least many of us do. And I know many of you are in public health and interested in how do we make sure that we have a long and satisfying life, and that we may have a quality of life that's right for everyone. Most recently, many of you may be aware that Marin was ranked #1 of all the counties in California by the University of Wisconsin based on a number of health indicators. But I'm going to let Tony talk a bit about that what's under the average is something that together as a community we need to work on. And I think Dr. Iton, with his work from Alameda, well, he's got a long pedigree that has enabled him to really identify areas that we need to work on together, and that's the only way change is going to happen. So I invite you to push back on Tony and what he says, so that we can get the truth and the clarity that we need to work together to ensure that everyone has a long, productive, and high quality of life in Marin. And I want to introduce my co-host, Supervisor Adams. Come on over here, Susan. As we all know, a phenomenal champion of healthcare for all, and that is not in the narrow sense, that's in the broadest way. And she, just to show you her commitment, she's going to be going over to Spain shortly to continue her research in part on comparative health systems, the Mediterranean diet. There are a number of things that apparently Spain offers that will be invaluable. And so Susan has 1 foot out the door, but she's here tonight, and as you know, working with us to make change happen in Marin. So Susan, I want to move this over to you, and thank you for
being here. All this started in Lowell High School.
Thank you. A fellow alumni over there. I also want to thank Dr. Meredith for his leadership in Health and Human Services. He has been a very important ally and partner for me as I try to make my visions become reality, sometimes at the expense of a few extra ibuprofen and Tums tablets. But Dr. Meredith has been an amazing advocate for making sure that everybody in our community has a level playing field. And we have a little way to go, but I think we're on the right track. Part of the reason for bringing this forum together, I've had many opportunities to hear Dr. Iton speak, and most recently he addressed our Health Steering Committee at the National Association of Counties General Assembly. Very well received, and some of the information that he presented created quite a dialogue across the counties, the 3,000 counties in our country, to talk about how do we address growing disparities. At the same time, we are also in this state trying to implement a piece of legislation, SB 375, which requires that we create sustainable communities addressing walkable, livable, bikeable communities, decreasing greenhouse gases, and looking at social justice and equity as we try to achieve these really important goals. So with no further ado, I'm going to introduce Dr. Iton, who's the Senior Vice President of Healthy Communities for the California Endowment. In October of 2009, he took that on, but before that, he served as a director of Alameda County's Health and Human Services. No easy task there. In that role, he oversaw the creation of an innovative public health practice designed to eliminate disparities by tackling the root causes of poor health that limit quality of life and lifespan in many of California's low-income communities. He also served for 3 years as the Director of Health and Human Services and School of Medicine Advisor for the city of Stamford, Connecticut. Concurrent to that, he also served as a physician in internal medicine for the hospital's HIV clinic. He served for 5 years as a primary care physician for the San Francisco Department of Public Health. And his career has been quite varied, numerous publications. He is also has a number of credentials after his name, and I have to have these notes in front of me because I lose track. He's definitely a Renaissance man. He earned his BS in neurophysiology with honors from McGill in Montreal, Quebec. He also has some mean hockey skills that he matches up with his fellow Canadian Dr. Meredith to live healthy lifestyles, active lifestyles. He earned his JD. He's got the attorney credentials after his name from University of California, Berkeley. And his medical degree is from Johns Hopkins. So he's learned a lot, he's studied a lot, and he is helping us to figure out how to navigate this very challenging issue of removing disparities in our system. With that, I give you Dr. Iton.
Well, good evening. I'm told I have to stand over here for the camera, although I get a little sort of restless. I might move around a little bit. First of all, it's a real pleasure to be here. Despite the fact that Marin County has sort of a reputation for, not having any problems, it has a remarkable constellation of just exceptional leadership, which I think is a little bit unfair. That you have Supervisor Adams, you've got Larry, you have very good public health department, and we need some of that leadership elsewhere in the state, quite frankly. So at the end of this presentation, I'm going to ask you to actually rotate counties. So you'll be working in Alpine County tomorrow morning, and we'll see if we can make a difference there. But seriously, the work that I'm going to talk about it's really important to understand that it doesn't happen without leadership. Leadership is critical in this work. And when you have good leaders, you make progress much faster than when you have people who sort of know the problem, think that it's an issue, but don't put themselves out there. And I think in Larry and Supervisor Adams, you've got people who put themselves out there. This campus is a testament to that leadership, and the work is not done. So it's always a pleasure for me to work with people who they figure that we've only got one life. What are we going to do with it? Let's just throw ourselves into some work that makes a difference. So what I want to do tonight is actually offer you a little bit of perspective into a journey in understanding some of the public health problems, or really the health problems that confronted myself and some other people, Larry included, Rochelle Ehrman, who's in this room, who came together quite a while ago out of frustration, quite frankly, recognizing that the tools that we had to address the kinds of health challenges that we're facing were inadequate, and that we needed to design different tools and strategies, which is not to denigrate the tools that we had at our disposal, because they're useful tools, but they tend to be narrowly focused on sort of the tail end of the problem. And as a consequence, they end up being very expensive and ultimately not satisfying, because we don't really see the needle move on the drivers of the health outcomes that we're having to deal with. So that's what this presentation is really about. It's about sort of the journey, a little bit of an intellectual and data-driven journey that we went through to sort of arrive at a different kind of public health practice. And the nice thing about it is that you can take health out of most of this, and you're still talking about the same thing. You're talking about sustainable communities. You're talking about equitable communities. You're talking about high quality of life. Call it whatever you want. This work is an invitation for a broad spectrum of the population to participate in the solutions. And that's one thing that healthcare doesn't do. Healthcare tends to be the domain of experts. Health is the domain of everybody. And the solutions can only be real and lasting if everybody is involved. Okay, so I'm a very simple person, and I like to state my conclusions up front. So this is my first conclusion, and that is that everything you need to know about the health of a community, you can tell from the eyes of children. And I challenge you to do this, and that is to walk the streets of the communities that you know are the quote-unquote least healthy, and look into the eyes of kids, generally around the ages of 12 to 15. Just look in their eyes, and they will tell you everything you need to know about how they see themselves valued in that society. And they will reflect to you what we tell them on a day-in, day-out basis about their relative worth. And that shapes their behaviors, that shapes their expectations, and that ultimately shapes their life trajectories. And we create that reality for them, and we can create a different reality. So these kids are telling us something about the health of their communities. These kids are telling us something else. And I've done this. And I've taken people to do it. I just walk the streets of Oakland, East Oakland, West Oakland, downtown Oakland, the Oakland Hills, wherever, and just look into the eyes of kids, 12-year-olds, 13-year-olds, 14-year-olds. That's the conclusion. We'll know when we've gotten there when we see it in the eyes of kids. This is the public health way of saying the very same thing. And in public health, we like charts. So this looks intimidating and frightening and obnoxious and academic, and it's all of those things. But I'm going to fill it in for you as we go along, and I think it's going to provide a useful framework for understanding this work. Okay, the first thing I like to point out is that in public health, we actually have a Bible. It's called Healthy People, and it gets updated every 10 years or so. It started in 1970, and then it was 1970's goals weren't met, so they revised them in 1980. Those weren't met, so they revised them in 1990, and so on and so on. So these are the 2010 goals, which were developed in 2000. We haven't met them, so we're working on 2020 now. But the first goal of Healthy People 2010 is to increase life expectancy and the quality of life for all people. And I just want you to understand that, because it's important to understand the practice that brings that goal into reality. And the practice that we're engaged in now in general in health is really not focused on that. And that's what we need to think about. And the second goal is to eliminate health disparities, and it used to say reduce. The change from reduce to eliminate is a significant change, and it actually challenges us to think much, much more upstream about how we approach health.